Alright, so here we are in 2 Point Hospital, and I have already progressed in the game, I guess a significant amount, but what I wanted to go over was the applications that this game could have in terms of nursing education and, well, really any education in healthcare. Let me just find a place. I think it's fitting we go to a university. This is one of my university hospitals. So this video isn't really to go over, everything about the game, but just some of the aspects that kind of go along with my idea with how a game similar to this, or if not this game itself, I think would be pretty useful for teaching students in healthcare, especially nursing, only because, well, that is what I can relate to as nursing school. Let's see if I could bring up an example. Fast forward first. So, patients coming in and they check in, and usually from here, depending on your settings, that um, they'll go for one visit to the doctor. It's called a GP office, and usually the doctor, depending on their skill level of diagnosis, they can help, diagnose the problem of each patient, and from there they go for treatment. So let's see, just pause it really quick and go to illnesses here. So some of the illnesses that we have currently, or at least the trend as well, include all of these things like bogwarts. See, if you look, there's a description. Can be cured with an expensive cocktail of drugs carefully prepared in the pharmacy or with witchcraft. Misery guts, chronic grumpiness due to nihilistic semicolon. Okay. Lazy bones. And lazy bones is something, well, if you read all these descriptions, they're all, kind of fun, kind of wacky. See, lightheadedness, patients notable due to their bulbous heads. Let's see if I could find someone. Here, this one, he has lightheadedness. If you click on this patient, right now he's waiting for his appointment in the GP office with the doctor so he can get diagnosed. And he hasn't been diagnosed yet, but I'm pretty sure as long as that's a good doctor, that he'll get diagnosed with lightheadedness. That's what patients look like when they have lightheadedness. You can see their mood, things that they've done, how long they've been here. Um, and usually if they have lightheadedness, they're going to go for treatment at, let's see, where do I even have one available? Here we go. They'd go here. Let's see.
End of year approaching.
There's no patients right now, but basically they'd go here, have a seat, and
Doctor required in GP's
they would get
office.
that light bulb removed. So going back to what I was thinking about regarding how we can use this kind of game for education is if patients are coming in and they get diagnosed, um, well, like one of the obvious things that could be done is putting
Assistant to reception.
more real life diagnosis, diagnosed with shingles, or maybe a patient that was admitted for shortness of breath diagnosis ended up in one of our wards here, and they developed respiratory failure. That's of course, hopefully, not the case, but it does happen, in real life. um, Elderly clients or any patients that have respiratory problems come in maybe with a complaint of shortness of breath, and they end up being hospitalized, and if things don't improve they might end up having an acute respiratory distress event or disorder, and they could end up having respiratory failure, and from here they would be consulted again by a visiting doctor, and they might want to do a consultation with another doctor. Let's not forget in this game there are You can hire multiple doctors. At this university, I've hired 30 of them. And maybe some of these doctors have specialties, let's say in cardiology or pulmonology. Right now, we have specialties, traits,
Maintenance
such
announcement.
as stamina
Pharmacy
training
water.
or general practice, motivation, bedside manner, and treatment. If you look at treatment, it says an increased treatment skills plus 10% treatment skill. Let me just pause the sound. So if you think about this, if you can substitute some of these or add certain traits or maybe specialties in some way, for example, let's see. Only doctors like Dr. Titus Nutt, he has radiology, which is allows him to use a mega scanner. And the mega scanner here I have is over here. This is the mega scanner. It looks like a giant, imaging machine, maybe like an MRI. And only doctors with that training can operate this scanner. And only that doctor can see a patient and run them through this and hopefully, you know, be successful. Uh, in this case, successful diagnosis or successful treatment. So, in the same way that we can have traits like radiology and even things like psychiatry, a doctor cannot in this game. Oops, I think I just pulled a doctor out of somewhere. Um, so here are the psychiatry locations. So a doctor cannot treat a patient um, with a psychiatric problem. So let's see, what's hers? Uh, Cure. She is suffering a boggled mind. You can see here, often caused by exposure to new, sometimes paradigm-altering information. Science has been able to derive the equation mind equals blown. Sadly, this equation has proven to be entirely useless. So again, it's both poking, a little bit of fun and wackiness. This is a game after all, but if we're thinking about real life applications, maybe this person has, I don't know, I mean, chronic depression or something. Maybe that would be their diagnosis. In this game, a doctor who, in this case, this is Fredward Hurricane, he has training in psychiatry, so he's able to do this. If he does not have that training, he will be able to participate. Well, actually, no. I think in this game, without a psychiatry trait, they can't even be placed in the psychiatry room like this. Um, However, if you think about it too, where was I going with this? Yes. So in real life, a person, let's say a doctor, has a special trait, and instead of psychiatry, maybe it's um, cardiology. So with the patient that I mentioned earlier, who checked in here, was diagnosed with, a complaint of the shortness of breath. They were admitted, and then they're in the ward, and they developed maybe acute respiratory distress, and it developed into respiratory failure. Let's say they were brought to the ICU, which I don't think at this point in the game, at least, there is an ICU that is available. There is a fracture ward, which is for like bone related injuries, just like the name suggests. But like yeah, in real life, or if this game were to include it, they could go to the ICU where they'd be treated, and within the ICU or within any of these departments, maybe um, additional details that can be added into the game are lists of medications, because right now we have a pharmacy where they pretty much just step in through this door, and the nurse that's in charge here, and here it's Tiffany Bobbing, she just operates this machine and a cup comes out and the patient drinks from that cup and they either feel better or they don't. So that is the essence, of taking medications, but maybe added details could be what are lists of medications that this client actually needs. The patient needs like certain heart medications. Maybe this patient, on a deeper level, maybe is unable to eat, through his mouth. He's on a ventilator in the ICU. So maybe he needs a gastric tube. He'll need feeding through that gastric tube. Things like that. I think because the way that even thinking about different games that have mods, people who develop mods, I think something like that wouldn't be so far-fetched in terms of adding details and adding, when you click on certain staff members like Nurse Desmond Trickett, we can actually not only adjust his pay as administrator, but if we look at, let's see, we can go to, I thought there was a way, well, I know when you go to, here, jobs, you can kind of, it will look for him here. Let's see, Desmond Trickett right here. We can toggle which jobs he has. Like maybe we want him to specialize in only working in the pharmacy or only working at the ward, things like this. Because you want to assign staff according to, their strength. If the see, for example, Desmond Manners, oh, which isn't, look at the wrong nurse. Where's Desmond? There he is. So Desmond Trickett, he has one of his traits is in injection admin, so he gets a bonus. So we'd want to make sure we assign him to injection, and maybe which is the orange squares here represent what he's assigned to. Um, Maybe we'd want him to focus mostly on injections, so we can click a bunch of these squares, gray them out so that he's only limited to doing these jobs that are in orange. So I think you can even use that in a way where maybe if this nurse works ICU, or if this nurse is a wound care nurse, or if this nurse is the charge nurse, we can have those traits here. And the purpose of all of these things I'm mentioning is again just to make a more realistic version of the game where it might be, I guess, in a way, a little boring compared to the fun and wacky nature of the game, which is really fun. I love the game. Um, but, if used as a tool for nursing education or any type of healthcare education, not let's say like as a main study tool, but as a supplement, I think it's great. Personally, even being a new nurse and being trained in different work environments, there is this anxiety of like, how does everything work? How do orders come in, and who do I talk to? How do I chart this? All of these questions I think can be answered by a lot of simulation games like this one.
Starting.
Let's see, see, look, the game also gets notifications. Um, this is a challenge. Maybe challenges could be adjusted or changed into something where, I don't know, let's say instead of a challenge card, it's something where um, a patient in the respiratory ward has abdominal distension. What would you like to assign a nurse to do with this client? And then there'd be different options. Maybe assign nurse and click on one of their objectives as maybe auscultating the abdomen, measuring the abdomen, checking for distension, and then contacting the doctor. And from there, being able to follow one of the doctor NPCs and seeing what he does. So I understand that something like this would take a lot of, well, yeah, it would take a lot of advice and maybe oversight from medical professionals. But there are so many medical professionals out there, including myself, that um, love to play games too and would love to contribute to something like this. So that's just my 2 cents on it, and I wanted to point that out visually by recording some parts of the game like this. Let's see if you could actually see anything. See this patient? They're getting their medication. You fast forward it, and That's not really how our pharmacies work, but it's a fun
Contents announcement.
representation.
Toilets need routine
This
servicing.
room is for additional diagnosis. It's in this case, it's like in a physical, you run the treadmill, kind of check the status of your heart, and this is called the heart racer. And yeah, I mean, the game has a lot of great details in it already. It does a really great job at
Nurse, please go
dividing
to
the
the
different
pharmacy.
aspects of healthcare, but since we're in the perspective of an administrator, I think there is, of course, a large emphasis on how much money is coming in and are enough profits being made so that our staff can be paid and can cover the patient population and the most common illnesses that are present in the population. It does a great job of implementing that, really much like Hospital Tycoon or Theme Hospital. So it's really great. And all I want to point out was the potential for some of those things I mentioned about the details about the patient care, their diagnosis, the order of how they're seen, some of the some of the departments and units that the patients are assigned to, and then even more important, I think, for at least the nursing aspect, is having a way to see the interface um, of the charting system, the orders that come in, and so on. I think if there could be a way where these things can be managed by the game itself, but allow us to zoom in
Assistant
to
wanted in reception.
a specific patient to see their orders, to see their their diagnosis, to see the plans of care from the doctor, even some nursing notes. I think that would be incredible, and I think that would revolutionize the way a lot of institutions go about teaching in regards to healthcare. I would personally say that I think it would make a huge difference in nursing education, both in nursing schools and for nurses that are maybe new to their work setting, whether it be a hospital, public health setting, clinic, um, even in a school, like if they're a school nurse. I think different, you can say maybe DLCs could be implemented to focus on those different areas, and from there, yeah, make it so that the nurse or whoever, the medical professional, will be able to learn a lot more, even when they're not in the work setting, whether because they're applying for work or whether it's because they're thinking of working in that setting, or maybe if they're still a student and maybe they don't get enough of that exposure in clinicals. And from my experience in nursing school is that a lot of times we don't get enough hands-on experience in the hospital, for example, in terms of how the charting works, how the orders go, you know, who to call when this order comes in, or how do I interpret this order for blood labs, and which vials am I going to be using then? Of course, all these things differ by facility when we talk about hospitals, but if we can give a general skeleton, template of how things might work, just in general, what the order is of these tasks, which are given in settings like the hospital, I think would make a huge difference in education and in the future of nursing in general. And I can't speak maybe in detail for the other medical professionals, the professions, but maybe for nursing, since I am a public health nurse and I can relate to the struggles that exist working in different settings, including clinical, in the community, schools, and things like this. So that's my 2 cents on it, and who knows? Hopefully, one day we'll see um, a development like that in video games, maybe even this game. There are already some fun online games that some programs do, like Kahoot, which is kind of like trivia mixed with like competition. But this would bring it to a whole new level because we get to see an entire shift or entire case study pretty much work itself out. And that's what it would pretty much be. It would be a simulation of a case study from admission to the discharge, down to every detail of the orders, almost if not day by day, then week by week of what changes with the client, what medications are ordered, what are changed, what labs are ordered, and what makes certain labs pertinent and what
Would a
makes
listener
certain
please go to marketing?
procedures pertinent, and the results, how are they related, and what does that mean for the next step in terms of care for this patient. I think all of that would make a huge, huge, huge contribution to healthcare and nursing education. So that's pretty much my 2 cents. Again, I can't seem to talk about it enough. It's such, it's a topic that I just recently felt a huge passion for since I love games and since I am working in the healthcare field. But that's it for now. Thanks for watching.